Hi there, my name is Heather Martin and welcome to my YouTube channel. I'm going to be, through these videos, exploring the topic of pain patients, and pain management, and what pain patients go through trying to get medical assistance of any kind in the United States of America. I have been the partner of a chronic pain patient for about 12 years now, and I have firsthand seen the discrimination, bigotry, and abuse that chronic pain patients are subjected to trying to navigate the medical system. So my partner, who is also named Martin is his first name, like my last name. We are the Martins. So he was injured 20 years ago in a car accident, and this was before we met, and he lived in New Jersey, and he tried all kinds of treatment options. He went to surgeons. Surgeons advised him that the surgeries were not yet technologically where they should be, and advised him to wait until they were improved. He tried TENS units, physical therapy, every modality of pain treatment management he could think of. Acupuncture, diet and exercise. I mean, he was really trying everything to alleviate this pain. However, the only thing that did work for him was pain medicine. Pain medicine is a natural substance. It actually is herbal medicine. It comes from the sap of a flower called the poppy, the same as mixed poppy seeds in any breads and hard rolls and pastries you might like. So it's a natural medicine, and it worked for him. I know for some people it doesn't work, and everybody has a different physiology, a different tolerance. People need different levels of medication, but for him, a fairly large level of pain medicine, opiate pain medicine, did the trick. So when he and I got together, he had come up to New York from New Jersey and was in the VA healthcare system. And the VA hospital said, well, they had him on fentanyl patches. They're these little stickers that have the medicine in them. They're applied to the skin and absorbed through the patient's skin into their body. He was on these patches, which work for some people. They're great. But for him, he was highly allergic to maybe the adhesive or the conduit substance. Some aspect of these fentanyl patches caused him to break out into a horrible red rash wherever they were applied. So the VA would not take him off of these patches. They would not consider putting him back on the pills that had worked so well and did not have this rash reaction. They said that he was quote-unquote stabilized on the fentanyl patches. So desperate to get rid of this horrible, all-encompassing, full-body rash, these patches took up a large area of his skin with each application and had to be moved around, so he'd be always hunting for a piece of skin that was not terribly irritated to apply the next patches to. Every time he had to change his dosage, so it was a really grotesque kind of situation. So he went to the Civilian Pain Management Center, which was out of Columbia Memorial Hospital in Hudson, New York, and at that time headed by a Dr. Thomas Andreuk, whose specialty was epidural steroid injections. He promised that if these injections were not effective to control Martin's pain, he would give him the pain medicine, the pills. So that was held out as a dangling carrot. And Martin went through radiation because the injections have to be done under an X-ray, because these are very dangerous procedures that go very far and sometimes into the spinal nervous tissue. And so he endured these injections, which did nothing for the pain. They only made it worse because, then he'd have this invasive injection and frequent travel to go to this place. So he kept having more and more injections, all of them as ineffective as the last, and the doctor's solution was always, well, let's try some more injections. The last proposal was that he was going to put one up through Martin's tailbone into all of the nervous tissue in the tailbone and apply this ineffective substance there. However, we were very fortunate at that time to learn through word of mouth about a private practitioner. And we went to this doctor's office, and he had posters all over the office saying, "No opioids prescribed from this office." However, he did take Martin on as a patient, and much like the doctor in New Jersey, he got him up to a level. Martin has a very high tolerance for medications. He responds very well to them, but he's also very tolerant, and he requires a higher level than is appropriate for a lot of people. But this is his level of where the medicine is most effective for him and the side effects are manageable. So he was with this doctor for about 10 years. And when he got his medicine up to a better level, a higher level, he became more active. He was very much interested in nature photography and would go outside of our home and photograph flowers, and he is doing very beautiful work. He could still only sit, he cannot sit up for more than like an hour or so at a time, sitting straight up. He has to be reclined. That's the position that causes him the least pain. He can stand and walk for a very limited amount of time, drive a car, but again, there's a long recovery after any kind of vehicle trip. So, but being on that medicine, having medicine for breakthrough pain, he was able to participate more in life and enjoy a quality of life that he has not been able to enjoy since 2013. What happened in 2013 is both of us have longed to leave this area. We're both native New Yorkers, and we're born and raised here, and really would like to start a new life in a new place. And we moved to Seattle, Washington. We had an opportunity to go out there. We brought all of our belongings in a U-Haul. It was a one-way trip. And we expected that, a well-documented case such as his, where the injury has MRIs, stacks of supporting evidence, that he would have no problem simply continuing the treatment that he had had all these years. But when we got to Washington, just at that time, is really when the fallout from the crackdown coming from the CDC and the DEA, coming down, trickling down from the federal government, down into the states, down into the Department of Health, where doctors are being persecuted. There's this demonization of pain medicine in the mass media. It's being erroneously called an epidemic. And doctors lost their license simply based on the number of prescriptions that they were prescribing, not taking into consideration any of the actual patients and their legitimate needs. So when we got there, we found ourselves in an atmosphere where doctors were absolutely terrified of treating pain patients. Even trying to get referrals and going to a pain management center, we were told that the maximum we could get was 120 milligrams for non-terminal pain. We were literally told to our faces, and this is one of the reasons I was prompted to get this camera and to really start documenting what goes on. And I encourage everyone who sees a doctor to bring some kind of a recording device, because we really need to document these abuses that are going on behind closed doors. We had a doctor tell us to our faces, quote, "If you want pain medicine, get cancer." That's right, get cancer. We were told, if you want relief from legitimate suffering, get a terminal disease. And I think if this is where we are in our society, and doctors are telling pain patients to get terminal diseases, something is really seriously wrong, and it's not the pain medicine. So what had happened in Washington was the Department of Health released some guidelines. While they allowed higher levels for people with AIDS or cancer with terminal pain, they stated in the guidelines that any private practitioner treating a regular pain patient who needed more than 120 milligrams a day needed to consult with a pain management specialist before being allowed to continue with the treatment. That sounds somewhat reasonable on paper. And we even printed out copies of this guideline and took them to the pain management centers, where they looked at it and they said, yeah, we're still not going to prescribe more than 120 milligrams here because we'll lose our licenses. They're looking at every prescription that's written out of a pain management center, and we just simply cannot afford to treat non-cancer pain. So we realized that we couldn't stay in the state of Washington. I had gotten the job of my absolute dreams there, was totally ecstatic, and in 6 months had to leave because I could not in good conscience stay in a place where my partner would be forced to be bedridden with intense agony. This is literal torture. We started wending our way eastward toward the doctor that had been treating him, since it was what we felt the only sure bet. As we had gotten further into researching what was happening, we saw that this crackdown, this difficulty was happening nationwide. It wasn't just in Washington. It was happening everywhere. It was even simultaneously happening in New York. But we tried to not leave the Pacific Northwest immediately and tried to set up a life in Montana. So we got to Montana and first made contact with a doctor there who was supposed to give Martin a referral into the pain management center. Because if you're a patient, you can't just simply walk into a pain management center and ask to be seen. You have to have your primary physician send your records to your new physician, that physician give you a referral to the pain management center. It's a process that takes about 2 months. So he went to see this Dr. Smith in Plains, Montana, who examined him, who promised him the recommendation to the pain management center in Missoula. Now in Montana, it's those of you in the East might find this hard to understand, but it's an incredibly vast area. So when I'm saying that there's a pain management center in Missoula, I'm saying that is the only pain management center for hundreds of miles around, because there's not really any other hospitals. It's a very vast area. So we waited for Dr. Smith to send in the referral, and the pain management center hadn't gotten it. And then Martin called Dr. Smith's office and was told by one of his receptionists that Dr. Smith does not want to be your doctor. And that was that. 2 months wasted. And so we had to go through another doctor and get into another appointment, and that doctor did give the referral, and Martin went to Missoula. And this is the solution that they had in Missoula. There we go. Their solution in Missoula is that nobody really needs pain medicine. All they need is pain school. Yeah. This is a real thing. Pain school. This is their solution for people in areas, I say, is hundreds of miles, vast expanse, rural area, low incomes, and this is all they have to offer. So the idea here is that you attend this pain school and you become a Jedi Master. You see, you practice meditation and physical therapy, exercise, like as if, hasn't tried that before. So this was their solution, this pain school. Now this pain school was completely inaccessible to us because it was about 100 miles from where we lived. When Martin travels a great distance like that, he needs about 2 days to recover. This pain school's twice a week, so we could not afford the gas, could not afford the pain, and it was pretty obvious from everything we saw about it. absolute malarkey. So in Montana, all they wanted to do was titrate Martin down to a dosage of 0 milligrams. And when we asked for any advice, any personal lessons from pain school about how we might supplement his lack of medicine with another form of pain management, we were just told that if we kept asking questions, he wouldn't even get a titrated down prescription. So again, we had to leave that state and continue east to New York. When Martin reached New York and went back to his doctor, that doctor had already suffered the brunt of these regulations and further crackdown. He looked at the last prescription that Martin had gotten from the doctors in Montana who were in the process of titrating him down and would only continue that prescription. It was not a sufficient level of medicine for Martin. He was in extreme agony all of the time. He had no breakthrough medicine. He was only given time-release medicine and not enough of it. So he had pain medicine, but not enough. And that's been the best we can do. So that we came back to New York in 2014. Right now, as I'm recording this is May 2016. And recently Martin's doctor did increase his dosage. He has been slowly increasing. It's been a process between 2014 and 2016. Recently Martin did get some breakthrough medication. Unfortunately, that came after his brother-in-law's funeral, which he was unable to attend because after having gone to the wake, he was in too much pain to attend the funeral. Just another example of how many life experiences he's missing out on and quality of life by being under-medicated. Last month, he went to the doctor and got a notice that the doctor is retiring. In the first paragraph of this letter, he stipulated that the regulations are the factor driving him out of practice at this time. This doctor's planning to leave the country, and he's operating for a short time on a cash-only basis, which is out of reach for my partner and I, as he's got Medicare and is disabled on a small disability pension and living in this economically depressed area, which is not Seattle, and the place I was trying to leave. I have to work multiple jobs, and it's very hard to even pay rent on a studio apartment. So that's the situation we're in. We are trying to find another doctor, trying to continue Martin's treatment, and I'm going to be documenting our journey to do so. And I hope that you will subscribe and join us. Please leave your comments, share your experiences, and follow along, and I hope the story does have a happy ending somewhere. We'll see. Thank you. Bye-bye.